Hi, welcome to Better Longer. My name is Dr. Marc Demers, and I'm a board-certified surgeon, surgical oncologist, and NAMS certified menopause practitioner. This is one of several videos I am making about a very important element of our health, and that is the amount of visceral fat we may have. The focus of this video really is on general principles you should be comfortable with if you are engaging in an effort to reduce the amount of visceral fat that you have. You must understand that visceral fat is not an illness by itself. Rather, it is part of a continuum of problems, and visceral fat is only one manifestation. These problems can include things like metabolic dysfunction, insulin resistance, prediabetes, type 2 diabetes, liver failure, heart attack and stroke, and even early cognitive decline or dementia. So these are serious things that you are trying to combat, and every opportunity we can provide to help you in that, we are going to do. So this video really has to do with a general understanding of what it is you are facing and a kind of opportunity to know your enemy. So, number one, expect discomfort. In order for the amount of visceral fat in your body to change, and in order for the metabolic dysfunction that you are suffering, in order for that to change, substantial changes need to be made in how you do lots of things, including your diet and exercise and lots of other elements of your life. Change can be very, very uncomfortable, and that is certainly true when people attempt to change their activity levels and the way they nourish themselves. So number one is expect discomfort, and also eventually expect lots of comfort in the form of new experiences that are better than the ones that they replace. Next, measure everything you can about yourself. For example, almost everyone has a home scale to measure their weight. Do that to yourself every day or every other day. Check your weight so you are never surprised by what you see on the scale, and you begin to learn what happens when you have little indiscretions, how much weight that may mean that you put back on after trying so hard to lose some weight. Number two, lots of people with visceral fat also have high blood pressure or hypertension. You should purchase an automated blood pressure cuff to use at home and take your blood pressure regularly, a few times a week, so that you know if your blood pressure is good or if it's high. We generally think of a blood pressure that is favorable as being one that is 120/80 or less. If it is higher than that, you should talk to your physician about getting care for your blood pressure. Next, you should consider obtaining a DEXA scan at the outset of your effort to combat visceral fat, and consider getting them every year or 6 months as you go through this long process. DEXA scan is simply the most accurate way to measure the percentage body fat that you have, and it can also calculate the percentage of your body fat that is visceral fat, and they can produce a number for you in pounds, so you know how many pounds of visceral fat you have. If you know you started off with 2.5 pounds of visceral fat, and after 6 months it's 2.1 pounds, well, that's a huge victory. You may not know it unless you measure it. So measure what you can, and a DEXA scan is a very good thing to measure at the outset, and then at intervals of every 6 months to a year. Finally, make sure that your doctor is measuring certain aspects of your blood tests, including your fasting blood glucose level and your hemoglobin A1C level. These are very important to find out how you are managing your carbohydrates. Also, you should have a cardiac profile done such that you know your total cholesterol, LDL cholesterol, HDL cholesterol, and related values. Next, I would say that the most difficult parts of the effort to combat visceral fat are those involving changes in your diet and changes in the amount of activity that you perform during the day. In another video, I speak to the changes that are required in diet, and I also speak about exercise. For most people who have significant levels of visceral fat, exercise can be daunting, it can be embarrassing, and it can be very, very uncomfortable. That said, those are not reasons to forego exercise, because using your muscles is one of the most important elements of combating visceral fat. Fortunately, the very best kind of exercise for people with visceral fat, which is called Zone 2 aerobic activity, is also one of the easiest to begin. Most people can walk, and walking at a brisk pace is a great form of Zone 2 aerobic exercise. Now, if you haven't walked in a while, 5 minutes of walking may be all you can do on a given day, but you should try to do it every day, and eventually 10 minutes, and then 20, and then more, until you are ultimately able to perform that relatively low intensity of exercise for 1 hour in an uninterrupted way. And when you can do that, you will have achieved something really powerful, and you should really begin to see the effects of your exercise paying off in terms of a significant reduction in your visceral fat, a reduction in your hemoglobin A1C, a reduction in your fasting glucose level, and a reduction in your weight overall, and, if you're lucky, a reduction in your blood pressure as well. It's important to measure these things so that you can identify wins as they occur. Because if all you're waiting for is that one big win at the end when you don't have too much visceral fat anymore, you're really missing a lot of opportunities to see substantial improvements in your health as time goes by. Good luck with your efforts to combat visceral fat.